For this week's discussion, we'll be talking about mandated reporting and confidentiality and intimate partner violence. I do know that when it comes to healthcare professionals such as myself, as well as clinicians and therapists, it is mandated that any type of intimate partner violence is reported, especially when involving children, elders, and those that are vulnerable, adults that are vulnerable and at risk for harm. For those clients, confidentiality is a priority unless the client is at imminent risk of harming themselves or others. So if it's just something that they're confiding in and letting you know, it's different. But if this harm is being done to a child, an elderly person, or someone who is vulnerable, it does have to be reported by those professionals. Um, for myself, with past nursing experiences with intimate partner violence, I had experience with both those that were victims and perpetrators. For the victims, it was about making sure that they were safe and they were provided with some community resources like shelters and counseling, and also that they received some emotional support related to the violence that they were facing. When it comes to the perpetrators, the big thing was addressing the issue and their underlying issues, such as mental health disorders. A lot of times that is the cause, as well as like having substance use disorders, or they may have anger management issues. And they often needed a collaborative approach with some type of behavior therapist. For the therapy approach for the perpetrators can include cognitive behavior therapy. Is particularly effective because it helps to the client to recognize and change the harmful thought patterns that they have that cause them to do these actions to others and have abusive behaviors. Addressing the client's history of general physical abuse is also critical, because unresolved trauma oftentimes is the cause as to why individuals and perpetrators do this to others. Trauma forced therapy and eye movement desensitization and reprocessing can also be beneficial for those people who need healing from some of their past wounds. Group therapy may or may not be effective depending on the patient and if it's suitable for them. And some perpetrators benefit from group interventions like batterer intervention programs due to their peer accountability and shared experiences with others. Group settings can sometimes be helpful and reinforce their negative behaviors as well. Sometimes they hear what other people have went through and some of the things that has triggered them, and then they recognize triggers they didn't understand they had. So that can also be helpful with some people as well, and be less effective for those with unresolved trauma. Unfortunately, if they don't resolve the trauma. A thorough assessment is very much needed for the patient that is dealing with the trauma as well as the perpetrator. That's a big thing. They need to see the right professionals, healthcare professionals, mental health professionals, and receive the treatment so that they can have a positive future. Because if not, the trauma persists and it can cause them to have other mental health disorders as the victim, and then the perpetrator can continue to have those same issues with every different person they come in contact with. Whether this intimate relationship works and they end up in another one, or they never resolve their issues, then they'll be harming someone else. And it just is a pattern that keeps going and going. And that wraps it up. Thank you.